I want to discuss gallstone today because I see a lot of patients having gallstone. First of all, which kind of people have gallstone? People that have gallstone are more likely to be overweight than slim, female than male, older than younger, and if they have ever been, among the female, if they ever been pregnant before, they have a higher chance of having a gallstone. Diabetic patients are likely to have gallstone. People with high cholesterol are more likely to have gallstone. But I've seen young, thin male having gallstone as well. So all this is just risk factor. They're just a risk. You can get gallstone even without any risk factor. Gallstones are common. Some population study estimate roughly 1 in 10 people in the general public, depending on how you measure, have gallstones. So I joke with my patient to say that gallstones are common. If it don't cause problem, leave it. But you can, next time when you go for your class reunion, ask around. Who had gallstone? Raise a hand. You'll be surprised that many people in your old class will have gallstone. The good thing about gallstone is that it does not cause problem most of the time. Roughly, by estimation, in the person's lifetime, roughly only 10% of all the gallstone will ever cause problem. In other words, if you have gallstone, roughly 90% of the time you go to heaven or hell with your gallbladder and the gallstones. So, but the funny thing is, when the gallstone cause problem, say they come out to block the bile duct, they will keep having problem. So we told the patient, if you have asymptomatic gallstone, leave it, just watch. But if you have a gallstone that causes you problem, cause pain or infection, you better take it out, because when you get a gallstone complication like they cause a gallbladder infection, a stone in the bile duct, or they cause pancreatitis, the risk of it coming back is about 30 to 40% over the next few years. So I have patients that have a gallstone. What are the complications that can happen? When they have the gallbladder, when the gallbladder contracts, juice come out. The stone may come out to block the opening of the gallbladder. In that case, gallbladder got jammed, it becomes swollen, and it will cause infection and severe pain like hell. Sometimes the stone comes to block the bile duct. In the bile duct stone, they will cause a lot of pain, worse after eating, again pain like hell. And because they jam the bile duct, they will also turn eye to be yellow, urine to be dark color. And sometimes the stone block the opening of the pancreatic duct and it causes pancreatitis, severe pain goes to the back. In other words, almost all the gallbladder problems are severe pain, either on the right upper abdomen or the middle abdomen, severe pain worse after eating. If you have these symptoms, severe abdominal pain worse after eating, and you are known to have gallstone, you better check with your doctor that maybe the gallbladder stone causing problem. If the stone, how do we treat gallstone? If they don't cause problem, we don't treat, we leave it alone. Sometimes patients ask, should I go for surgery to remove the gallstone? I said no, because 90% of the time, gallstone won't cause you problem. And if you go for surgery, you take the risk immediately, and you may have nothing to gain. So we don't recommend any surgery for people without gallbladder complication. And how do we do the surgery? We can do it keyhole through the belly button, 2 or 3 other holes, and they will have very small scar, they'll be okay. And for some very skilled laparoscopic surgeon, they can even remove the gallbladder with only 1 scar around the belly button, because it's single port laparoscopic cholecystectomy. The scar is almost hidden. I joke from a patient saying that for men, you can still join manhunt, nobody can see the scar. For the female, you can wear bikini, and nobody except your husband can find the scar. Are there medications that can dissolve the gallstone? Yes, there is. There's some bile salt called ursodeoxycholic acid that can help to dissolve the gallstone, but it takes months to years to do the job. And ursodeoxycholic acid can be expensive, can be a few $100s a month, and it may cause some tummy discomfort and loose motion. And when you stop the medicine, the gallstone may form back. So we don't recommend giving dissolution therapy. Most of the time, if the gallstone cause problem, we ask the patient to take out the whole gallbladder with the gallstone. If you don't have a gallbladder, what will happen? If you and I both go for suckling pig buffet, my gallbladder contracts to squeeze the juice out. If you don't have a gallbladder, you cannot digest extra fat, so you feel bloated and have diarrhea. So for patients without a gallbladder, they need to be very careful. They should avoid taking a lot of oily food. After gallbladder surgery, how long they take to recover? They take about a day. Most of the patients can be discharged the following day, very rarely the day after. So to sum up, the important point is, first, gallstone is very common. They can cause severe pain worse after eating, but 90% of the time on estimate, they will not cause any problem. We do not recommend gallbladder surgery unless you have symptoms from the gallstone. Otherwise, leave the gallstone behind, go to heaven, see St. Peter, see God, together with the gallstone. I hope I answered your question.